told your friend you're not okay? And tell me what's wrong and why you never said you felt that way. And guess you're trying to stay strong and fake a smile until I look away. But I've known you too long, it hurts to watch your blue eyes fill.
Leave your host, and tonight my guest is one of Bay Area's remarkable plastic surgeons, Dr. David White of the Palo Alto Medical Foundation. And I cannot wait because I have so many questions for him. Dr. White, thank you so much for taking the time to come on my show.
Nice to be here.
So you have been a plastic surgeon for how many years?
35 years.
35 years. So you're what we call a veteran.
Seen the wars.
You've seen the wars. What made you choose plastic surgery?
It's such an interesting phenomenon when you see the emotional connection that comes between seeing someone and making up your mind about who they are. And we attribute beauty with goodness. And it has to do with facial contour.
Yes.
And so somehow there's this mixture between facial contour and symmetry and how we view people. And the fact that you can change those contours and make someone look happier or more friendly or warmer or whatever, and really not change their personalities at all is fascinating to me. I'm a sculptor and painter, and I really enjoy doing bronze busts of various individuals and the like. And when you do those things, you're kind of building on the facial skeleton in a way that you do when you're a plastic surgeon. You
Right.
kind of bring things along. So it was a nice mixture of art and medicine and art and science.
So I could see how you would, if you're a sculptor, how being a plastic surgeon would be so great, because one you're doing with clay and material, and the other you're doing with someone's face. I could see the correlation.
Works well.
Well, I know some of your patients, and they've all spoken really highly of you, and I'm one of your patients, and I know how great you are. So what is new in this industry? What is someone told me now that there is some technology where you could take someone's blood and spin it and inject it into their breast, so instead of putting implants, you can actually force the breast. Can you tell me anything about those?
Well, that was debuted probably 5 or 6 years ago.
Okay.
And it was designed to be a filler that one uses to fill in lines on the face or make lips fuller or whatever.
Yes.
In our experience, it didn't last as long as the regular fillers, and it was somewhat disappointing. So I don't know that that's being done much anymore. I think it made a little splash in the media, but I don't know anyone who's using that technology any longer.
Okay, because I just heard from a friend that this is what surgeons in Beverly Hills are doing now for the breast. So maybe I was misinformed. But I just had to ask you about that.
For the breast?
Yes.
No, I haven't heard that.
Yeah, that's what I heard. So I didn't know. Because I have a friend who would like to get her breast done, and she was told to wait for this technology. And I thought, I had to make sure I ask you this for her. So over the years, what do you feel is the one thing that most women do? What is the most common procedure that women come to you for?
Well, we see lots of breast work when as women are younger, and as they get older, most of them are concerned about what's going on under their chin and their neck and the jowl areas and the bands in the neck.
Okay.
So I think there are sort of two age groups, a lot of body contouring things and tummy tucks in the younger group, or even in middle-aged group. But as people get into their middle years and older, it generally is facial rejuvenation.
Okay. So when it comes to the breast, there's been so much controversy and confusion over if saline is the safe way to go or if silicone is the safe way to go. And I've been asked to ask you this question. Which is the preferred and safest treatment now for women who want enhancements?
I think they're both quite safe. There was an
Okay.
allegation quite a long time ago, it's been 15 or 20 years,
Okay.
and there was a fellow named Kessler who was chairman of the FDA, and some allegations were made that silicone breast implants, specifically the silicone gel, caused autoimmune disease, and they were talking about polymyositis and dermatomyositis. And they were able to produce women who had breast implants who had these diseases.
Yes.
And on the basis of some anecdotal evidence, the products were taken off of the market, and it scared a lot of women who had these implants in for breast reconstruction following cancer, as well as cosmetic purposes. And as it kind of fell out, they found that in fact there were patients who had autoimmune disease and had implants, and there were patients who had autoimmune disease and had no implants. And if you take populations of equal sizes, there's no increased incidence of these autoimmune diseases in breast implanted patients. So the whole causation argument went away, and it's really been thoroughly vetted now by the FDA and some studies out of the Mayo Clinic and Harvard that really show that the silicone's quite safe. The silicone is preferable in my mind because it's less detectable. The salines, you're able to feel the edge of them very often or see some rippling through the skin. And though you can see some rippling sometimes with the silicone, it's less likely. And I think they're more natural and feel more like natural breasts, or less detectable.
Okay, so how do you feel about someone who has like fibrocystic disease? Is it recommended to have implants or not?
Well, I think that fibrocystic disease has a lot to do with what the imaging issues are for mammograms.
Right.
And there is some concern about breast implants hiding tumors on mammogram. With a good mammographer and proper technique, those things are generally able to be seen pretty well, but the fibrocystic problem doesn't go away.
Right.
But I don't think that adds any specific new problems having breast implants. So I think it's fine to go ahead. In my career, I've not seen one breast tumor that was missed because of breast implants being present.
Oh, that's great.
So it's pretty uncommon, though it certainly is understandable how that might happen. It's pretty rare.
Okay, so when they usually when they implant those prostheses, if that's a correct word, they usually put it behind the breast tissue.
It's behind the breast tissue or even farther in behind the muscle.
Okay.
It can be either way.
Okay, so it should be easy for them to continue to have mammograms.
Well, most people do well with mammograms, yeah.
Okay. And like eye lifts and facelifts, how often should someone have like an eye lift? Or the correct word for it?
Blepharoplasty.
Yes,
yeah.
I'm not going to try to say that.
You know, these things are so subjective and so individual. Some people last for 20 years after an eyelid surgery. Some people need to do something sooner. Eyelid surgeries tend to last a good long time.
Okay.
Occasionally you find someone who reaccumulates fat or skin over a few years, but most commonly it lasts a good long time. Facelifts 5 to 10 years usually. And whether you need to do something again is very personal and individual. The surgery picks you up on the timeline and moves you back 10 or 15 years, but nothing stops the clock, so you continue to age and move forward.
Right.
And it's a matter of, you know, if you're 75 and you look like you're 55, that's okay, you know, and to try to make yourself look like you're 45 by doing more cosmetic surgery may not make any real sense. And I find it's very poignant to see how really hard people are on themselves about their appearance, and cosmetic surgery is something one does for oneself, not for a boyfriend or a husband or seeking attention, but just to feel better about yourself. But on the other hand, people really do beat themselves up when they need, and people who look wonderful can always have something that they don't like, you know. And if you had a fabulous female movie star here in the studio now, there's things she could tell you that she doesn't like about her appearance. Everybody has them, and it's unfortunate to see how the mental gyrations that people go through with these imagined problems that really aren't problems. But it's very subjective.
Do you think it's true for men too, or do you think it's just, I mean, being a plastic surgeon, do you have men that come into you because they're fixated on something on themselves that they think needs to be fixed?
Generally speaking, we do see men and do a lot of men. Particularly here in the valley, and usually the issue is that you have a senior executive who's working with a lot of 20-somethings, and they don't like to be regarded as the old guy because they don't feel like the old guy, and they're dynamic
Right.
and their leadership and their ingenuity, but they would like to get some of those years taken off, and that usually equates to doing something about their neck and jaw areas and sometimes the eyes.
Okay.
But it's not nearly the numbers that you see in women. You see many more women than men. It's probably 15 to 20% of our patients are men and the rest are women.
Really?
Yeah.
Wow. So I know that different people react differently to surgeries. Would you say that certain ethnicities heal faster than others, or does it have to do more with an individual?
It's very individual.
Okay.
I think that concerns relative to ethnicity have to do with skin type to some degree.
Mm-hmm.
And after facial surgery, people are sun sensitive, and you can tan more darkly, particularly along scar lines if you tend to have an olive tone or darker complexion to start with. So those are considerations. Very fair people tend not to have those problems. But you can find people from various ethnicities who have very thick skin or very thin skin or very oily skin, or there's lots of choices in this world, and you can find virtually any variety in any particular ethnic group.
And I know some ethnicities or skin colors, I don't know which one it would be, keloid. Does everybody get keloids when they've been cut?
Only some people. Most people who think they form keloids really aren't forming keloids. They have hypertrophic scars, and a patient will say to me very often, I form keloids, and I say, show me the keloid, and they'll pull up their skirt or something, show me an old cut they had on their knee from years ago. That's a bit widened, but that's not a keloid. A keloid actually looks like you've taken silly putty and stuck it to the skin. It overflows the boundaries of the initial scar and gets large and heavy. And they are seen more commonly in darker skinned people, but lots of black people have cosmetic surgery with no problem at all. It also has to do with part of the body that it's on. The area right over the breastbone
Yes.
tends to form keloids much more easily than the face does. I've never seen a keloid with an eye lift. So that's very unusual. So there are lots of variables. Happily, not many people do form keloids. There are some things you can do to help them if they have, but you can't always get rid of them.
How do you generally treat one?
Well, you can use pressure garments. Topical silicone sheeting is used, removing the scar and redoing it. Injection with steroids
Yes.
is useful. Low-level radiation can be helpful in obliterating steroids. So it really depends upon what stage you're at. We usually start with injection or removing the keloid and trying a different type of closure to see if maybe suture material or something has something to do with it.
And if someone watching the show does not know what a keloid is, would you please tell us what a keloid is?
A keloid is a thickened raised scar that goes beyond that which you would ordinarily expect to have with a normal cut. And as I said, it looks like you've taken bubble gum or something and stuck it to the skin over the wound.
And when that occurs, how do you have to, if you want to get rid of it, how soon after it occurs do you have to treat it?
Well, when you see it happening, I like to jump on it
Right
quickly
away,
and
yeah.
inject quickly, and that seems to be helpful.
Yeah. Have you ever had a patient who, after you operated on them, for some reason ended up with complications that caused them to have to be hospitalized for a long time? Have you ever had that happen?
Haven't had anyone who needed to be hospitalized for a long time. I think if you are operating as long as I've been operating, you certainly have complications. About the most dramatic thing you have is people who bleed and need a transfusion and go to the hospital for a transfusion. I haven't had anyone die. I haven't had anyone have a permanent long-term bad result.
Okay.
But you certainly have complications. People get infected, and haven't had any of the meat-eating infections that you read about.
Yes.
But you treat people appropriately and usually can find a way through it. I think that's one of the key things in choosing a plastic surgeon, is making sure that they're well trained and can deal with complications, because complications are going to happen a certain percentage of the time, and if people stick with the surgeon and go with the program, virtually always we can get them through it. But
Yes.
it's frightening for the patient. It's the first time it's happened to them, and they wonder, has something gone wrong? Does this guy know what he's doing?
Sure, there's an element of that.
Yeah.
It's not easy being a doctor sometimes, because you have those patients who wants to blame the doctor for everything when they don't obey the rules.
Well, exactly.
I know I'm not a doctor, but we have a clinic, and I know some people, you tell them what to do, they don't do it, and then they say, you didn't do your stuff right. What was the most rewarding, or the patient that you were the most happy with so far, besides me?
Oh. Well, there are some severe facial injury reconstructions that come up over the years.
Yes.
I had a lovely woman who had her nose taken off by a dog, and was left with a triangular hole in her face, and had to have that reconstructed, and she came out beautifully and looks great, and that's very gratifying to be able to restore someone's life, because if you're living with that deformity, it's very tough. But to be able to get them back to where they used to be or close to it is very nice. Also, there are instances where someone has an outstanding feature that's not attractive, a large nose or something like that, and you do the rhinoplasty, and the patient's transformed. Their life changes. It's really really fascinating to see how that happens, and little things. Doing a facelift on someone. I had a lovely woman who worked at the Palo Medical Foundation who was a pretty woman, but was getting a little on, and we did a facelift and some eyes, and she really was rejuvenated and fell in love and got married, and her life changed. Not that plastic surgery does that for you all the time, but it's very gratifying when you see that you've had a role in that. I think that plastic surgery doesn't make those things happen, but it changes the patient's view of themselves and gives them an inner confidence that makes them relate to other people in a different way, and that can be helpful, and it's delightful for the surgeon when you see those things happen.
I could imagine how gratifying it must be for you every time you look at someone who's come into you unhappy with something, and then you make it for them the way they want it.
It is fun.
That's got to be so rewarding. So what types of plastic surgeries do you perform? Like, I know some doctors specialize in breasts, some do faces. What is your expertise?
I do lots of facelifts, lots of rhinoplasties, eyelids, tummy tucks, and breast lifts and augmentations. Those are the cosmetic things I do. I also do a fair amount of breast reconstruction following cancer.
Okay.
And that's very gratifying. That's
Yes.
really very nice.
Yes. And how often do you operate on patients?
Virtually every day. Virtually every day.
Sundays too?
Well, not on weekends, but occasionally on weekends. We usually do a 5-day week, and there's either at least minors every day and a few days in the main operating room doing bigger cases.
And I can tell you still love it so much.
I really do. It's an honor to be able to do it, and it's a sacred trust. For a patient to lie on the operating table and let you cut them, it requires some real confidence and trust, and I honor that. It's very important to me, and I'm glad to be able to do it.
So when you wake up every day, what makes you happy besides this? You know, some people wake up and they think, oh, today I'm going to be doing this, and you get really excited. I know some days I wake up and I'm like, oh, it's just another day. Do you wake up every day like, wow, I cannot wait to get to the clinic and do this?
Oh, I enjoy it a lot. I really do. It's just great going in and seeing patients. I think one of the side things that people probably don't realize is that surgeons or physicians enjoy the interaction with the patient, and you meet the nicest people, and it's particularly fascinating because often these people have a specific need, and they're coming to it on the most intimate terms, trying to get those needs met, and trying to solve their surgical problem, and that's very, very gratifying, and you form long-term friendships often with patients as a result.
Right. Well, based on what you've been sharing with me, you don't only do cosmetic, but you do a lot of reconstruction.
Do a reasonable amount of reconstruction.
Yes.
Sure do. Yeah.
So these are people who've been in accidents or
Accidents and cancers, and I did a hand surgery fellowship, so I still do some hand surgery. As you get older as a surgeon, your practice finds you, and most people come in asking for specifically cosmetic things. So as I've gotten older, my focus has shifted more to cosmetic surgery, so that's what I do mostly now. But I still do some hands, and I still do a lot of breast reconstruction.
what is your favorite surgery? What is the one procedure you really enjoy doing?
You know, I like so many of them. It's hard to
Okay.
say.
That's
I
great.
really love doing noses. I love doing facelifts. I used to do a lot of cleft lip and palate repair. Used to enjoy that quite a lot. I think things related to the face are the most obvious changes you see in a patient, and that's very gratifying.
I think it's so great. If I could do my life over again, that's what I would want to be, as a plastic surgeon. Yes. I grew up in South America where I didn't even know what the plastic surgeon was.
Mhm.
But I look at so many people who've had plastic surgery, and I know some of them before, and I see them after, and it's like they get a new lease on life.
Does turn things around very often.
Yes, but you can see the person just being a different person
Mm.
because they feel better about themselves. But I've also seen some cases where the results weren't quite so good.
Mhm. I always tell patients, patients will say, I can always spot a facelift. I never have a facelift because I can always spot a facelift. And my response to that is you can always spot a bad facelift. It's like a toupee. You can always spot a bad toupee. If it's done well, you don't know it's there.
Right,
And
it's
and
true.
my goal is to make patients look like they haven't been operated on.
Right.
We don't want people to look pulled and tight and get the wind tunnel look, so
Right.
everything's smushed
Yes,
back.
yes.
So yes, you can see some unfortunate results, but there are lots of people walking around who look very natural and normal and lovely, who've had the surgery, and you'd never know they had it. You
Right.
simply think they look like that.
Because are you a doctor who will say no? There's some patients you can't do enough to them. I mean, we just have a cosmetic clinic, and we have people that come to do their lips, and they wanted more and more and
Yeah,
more.
we do have
How do you get them to say, I'm sorry? Do you ever
Oh,
say,
absolutely.
I'm
Oh,
sorry,
absolutely. You have
I
to.
can't do this anymore because,
Yeah. They're coming to you seeking expertise, and there's a time, and part of that expertise is knowing when not to operate.
Right.
And it's important to say no when the time is right. And
have you had to do that a lot?
oh, sure. Not a lot, happily. I think most people are pretty sane about these things, but you can find people who get really carried away, I think that the surest way to have an unhappy patient is have expectations that can't be met.
Mm-hmm.
And if a patient's asking me to do something that I think I can't meet, then the only thing to do is to say no, because you're doomed to unhappiness if you don't.
Right. Well, I would imagine that there are some people who feel like it's never enough. And I know that in every type of, in your industry, you're always going to have people like this because they think, okay, it looks great now, but I want more and I want more and I want more. And when you turn these types of people away, do you ever see them again, like down the road? Do they come back?
Well, they come back for other things or whatever.
Okay.
You would think that in a plastic surgical practice that you would see someone one time and that would be it. But I have patients I've been taking care of for 30 years who come in for one thing and another. You take care of their kids when the kid falls off the bicycle and has to have the face sewn up, and people come in for one surgery and need a touch-up. I've redone some facelifts I did years ago, and
Okay.
so you get to see the same people again, and there's a general friendly relationship that exists there. It's a lot of fun for me.
So I was told to ask you about this. can you reduce the size of an areola?
There's a technique, it's called a Benelli technique, where you, yes, you can.
It can be
there are
done.
technical ways to do it, yes.
Okay.
Not without scars, but the scars generally mature and are pretty inconspicuous once everything's settled.
Okay, and I was also asked to ask you if it can be done on a local.
Yes, you can do it on a local.
You can do it on local, so you don't have to put the patient out.
Yeah.
And how do you generally do a breast reduction?
Well, it's...
Is that too technical?
It is rather technical, but
Okay.
you know what you're doing is moving the nipple to a higher position. So a breast reduction almost always involves doing a breast lift.
Okay.
And you're moving the nipple to a higher position, and you're wrapping the skin around the new nipple position and removing some of the breast tissue on the sides and above in order to do that. So you generally wind up with a scar that runs in the fold under the breast, and then a vertical scar that comes up to the areola.
Wow.
But that's how
Very
it's done. We do a
involved.
lot of breast reductions.
You
That's
do?
Yeah.
Would you say you do more implants or more reductions?
Probably more implants, but there are lots of reductions.
Okay.
Lots and lots of reductions.
Okay, and then tummy tucks.
Hmm.
How long does one take to recover from those? I was told to ask you that too.
Well, you can do virtually anything you want to do in terms of activity after about 6 weeks.
Wow, that's a
but
long time.
you've lifted the skin up from its nerve supply and you lay it back down, so it's numb. And it takes months for that sensation to come back, and it never really comes back fully. It's always just a little fuzzy. And it takes time for things to settle, because tummy tucks involve not only getting rid of the roll of fat and skin, but also tightening the muscle on the inside. And that the muscular closure can be uncomfortable, and it takes a while for that to settle in.
Oh, that must be
So-
painful if you're cutting
Well,
into the muscle.
It can be. It can be. Not everyone needs that part of it, but
Okay.
so it takes a while for everything to settle before you don't feel any twinges and tweaks. And
And there's no other way to do it except to give you that long incision. You have to,
well, if you're taking skin out, it's got to come from somewhere. So
Okay.
you know, if you're just doing liposuction, obviously you don't need to do that. But people often come in thinking they want liposuction when they really need a tummy tuck, because if you do liposuction on someone who's a bit older and has a lot of fat, you wind up with hanging skin. The skin doesn't go back to where you want it to be, so that's a
and
problem.
no amount of exercise is going to fix that.
Exercise doesn't tighten skin, unfortunately.
Right, yeah. Well, we're running out of time. Believe it or not, we're down to 1 minute. What would you say to someone who would love to do change something on their body, but they're afraid?
Well, it's not for everyone, and I think that anticipation tends to be the worst part of all of these surgeries, and patients usually say at the end, gee, is that all there was to it? If I had known, I would have done it earlier. But I don't think anyone should be talked into anything, and
Okay.
I would be skeptical of any surgeon who tries to sell too hard, because that leads to problems. It's not for everyone.
Thank you so much, Dr. White. I hope you have enjoyed him as much as I have. I hope I've asked him all the questions that I needed to for you to get answers if you've had or needed answers. But if you're looking for a plastic surgeon, here's the guy. Please feel free to contact me at my website, and I will give you his contact information. And thank you for watching the Jennylyn Show. Dr. White, that was
Thank you.
great.
It was fun.
Thank you so much.
Thanks for having me.
I'm so sorry we had that little hiccup in the middle, but
It's okay.
you're